खोलो दरवाजे पर्दे करो किनारे, खूंटे से बंदी है हवा मिल के छुड़ाओ सारे। आ जाओ पतंग लेके अपने ही रंग लेके, आसमां का शामियाना आज हमें है सजाना। क्यों इस कदर हैरान तू, मौसम का है मेहमान तू। ओ दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है झम से बिखर, तू है नदियों बेखबर। खोलो खोलो दरवाजे पर्दे करो किनारे, खूंटे से बंदी है हवा, मिल के छुड़ाओ सारे। आ जाओ पतंग लेके अपने ही रंग लेके, आसमां का शामियाना आज हमें है सजाना। क्यों इस कदर हैरान तू, मौसम का है मेहमान तू। हो दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है झम से बिखर, तू है नदी ओ बेखबर। खोलो खोलो दरवाजे पर्दे करो किनारे, खूंटे से बंदी है हवा, मिल के छुड़ाओ सारे। आ जाओ पतंग लेके अपने ही रंग लेके, आसमां का शामियाना आज हमें है सजाना। क्यों इस कदर हैरान तू, मौसम का है मेहमान तू। हो दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है झम से बिखर, तू है नदी ओ बेखबर। खोलो खोलो दरवाजे पर्दे करो किनारे, खूंटे से बंदी है हवा, मिल के छुड़ाओ सारे। आ जाओ पतंग लेके अपने ही रंग लेके, आसमां का शामियाना आज हमें है सजाना। क्यों इस कदर हैरान तू, मौसम का है मेहमान तू। हो दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है झम से बिखर, तू है नदी ओ बेखबर। खोलो खोलो दरवाजे पर्दे करो किनारे, खूंटे से बंदी है हवा, मिल के छुड़ाओ सारे। आ जाओ पतंग लेके अपने ही रंग लेके, आसमां का शामियाना आज हमें है सजाना। क्यों इस कदर हैरान तू, मौसम का है मेहमान तू। हो दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है इस कदर हैरान तू, मौसम का है मेहमान तू। ओ दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है झम से बिखर, तू है नदी ओ बेखबर। खोलो खोलो दरवाजे पर्दे करो किनारे, खूंटे से बंदी है हवा मिल के छुड़ाओ सारे। आ जाओ पतंग लेके अपने ही रंग लेके, आसमां का शामियाना आज हमें है सजाना। क्यों इस कदर हैरान तू, मौसम का है मेहमान तू। ओ दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है झम से बिखर, तू है नदी ओ बेखबर। खोलो खोलो दरवाजे पर्दे करो किनारे, खूंटे से बंदी है हवा मिल के छुड़ाओ सारे। आ जाओ पतंग लेके अपने ही रंग लेके, आसमां का शामियाना आज हमें है सजाना। क्यों इस कदर हैरान तू, मौसम का है मेहमान तू। ओ दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है झम से बिखर, तू है नदी ओ बेखबर। खोलो खोलो दरवाजे पर्दे करो किनारे, खूंटे से बंदी है हवा मिल के छुड़ाओ सारे। आ जाओ पतंग लेके अपने ही रंग लेके, आसमां का शामियाना आज हमें है सजाना। क्यों इस कदर हैरान तू, मौसम का है मेहमान तू। ओ दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है झम से बिखर, तू है नदी ओ बेखबर। खोलो खोलो दरवाजे पर्दे करो किनारे, खूंटे से बंदी है हवा मिल के छुड़ाओ सारे। आ जाओ पतंग लेके अपने ही रंग लेके, आसमां का शामियाना आज हमें है सजाना। क्यों इस कदर हैरान तू, मौसम का है मेहमान तू। ओ दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है झम से बिखर, तू है नदी ओ बेखबर। खोलो दरवाजे पर्दे करो किनारे, खूंटे से बंदी है हवा मिल के छुड़ाओ सारे। आ जाओ पतंग लेके अपने ही रंग लेके, आसमां का शाम आना आज हमें है सजाना। क्यों इस कदर हैरान तू, मौसम का है मेहमान तू। हो दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है झम से बिखर, तू है नदी ओ बेखबर। खोलो खोलो दरवाजे पर्दे करो किनारे, खूंटे से बंदी है हवा मिल के छुड़ाओ सारे। आ जाओ पतंग लेके अपने ही रंग लेके, आसमां का शाम आना आज हमें है सजाना। क्यों इस कदर हैरान तू, मौसम का है मेहमान तू। हो दुनिया सजी तेरे लिए, खुद को जरा पहचान तू। तू धूप है झम से बिखर, तू है नदी ओ बेखबर।
Yes. Good evening, respected dignitaries, eminent speakers, esteemed participants, and dear colleagues. I am Bhagyashri Soni. It gives me great pleasure to welcome you all to day 3 of our AICTE Atal sponsored 6-day faculty development program on next gen medical devices, a fusion of artificial intelligence and 3D printing, organized by Modern Institute of Pharmaceutical Science, Indore. The last 2 days have set a remarkable tone with thought-provoking discussion and insightful session. Today, we continue this intellectual journey with 2 more enriching sessions focusing on some of the most impactful innovation shaping the future of healthcare. To formally begin today's proceeding, I would now like to invite our esteemed FDP coordinator and head of institute, Professor Dr. Sapna Malviya ma'am, to deliver the welcome address. Ma'am has been driving force behind this program, and her vision and leadership continue to inspire us all. To introduce her with our audience, I request the technical team to please play the AV.
A warm welcome to the Faculty Development Program on Next-Gen Medical Devices, a fusion of artificial intelligence and 3D printing, sponsored by AICTE Training and Learning, Atal, FDP Academy. Dr. Sapna Malviya, M.Pharm, Honours, MBA, HR, PhD, Pharmaceutical Sciences, DSc, Pharmaceutical Science, is Professor and Head of Institute at Modern Institute of Pharmaceutical Sciences, Indore. She also serves as Chief Mentor and in charge of HIBI at Modern Incubator, sponsored by MSME, Government of India, and Head of the R&D Department at ZED Consultant, QCI, New Delhi. Dr. Sapna Malviya is a distinguished academician and researcher. She holds pharmacy degrees from B.R. Nehta College of Pharmacy, Mandsaur, including B.Pharm, M.Pharm, Hons, MBA in Human Resources, PhD, and DSc in Pharmaceutical Sciences. Dr. Malviya has secured numerous research grants, including 30 lakhs rupees from MSME, Government of India. Under her mentorship, 2 projects were successfully selected and funded through MSME Idea Hackathon 4.0. She also received 30 lakhs rupees from AICTE, New Delhi, along with grants from other prestigious organizations such as Atal FDP, Madhya Pradesh Council of Science and Technology, MPCST, Atomic Energy Regulatory Board, Entrepreneurship Development Institute of India, and MHRD's Innovation Cell. She has given research consultancy to various pharmaceutical and allied industries. She is an editorial board and review panel of many reputed journals. As an innovation ambassador for the Ministry of Education and chief mentor at an MSME-sponsored incubator, Dr. Malviya continues to inspire the next generation of researchers and innovators. Her contributions as NBA coordinator led to successful accreditation for our institute, reflecting her dedication to academic quality and institutional growth. Her academic career is marked by exceptional contributions to pharmaceutical education and research. She has guided numerous undergraduate and postgraduate students in their projects and research, authored over 200 peer-reviewed national and international journal publications, written multiple textbooks published by CBS Publishers, New Delhi, CRC Press, Taylor and Francis Group, and other renowned publishers, and contributed chapters and articles on pharmacy education. Dr. Malviya has actively coordinated and chaired national seminars, workshops, faculty development programs, and executive development programs, including key roles within the Indian Pharmaceutical Association, IPA, IIC, MHRD, QCI New Delhi, and the Association of Pharmaceutical Teachers of India, APTI. She has been recognized as an NPTEL star in 3 categories: NPTEL Enthusiast, NPTEL Discipline Star, and NPTEL Believer, for her commitment to quality education. She is a lifetime honorary member of both IPA and APTI. Her scientific endeavors have been widely recognized with multiple awards, including the Best Jury Award at the 7th Academic Brilliance Awards, 2019, Best Teacher Award in Pharmacognosy by APTI MP State Branch, Excellence Award in MPCST-sponsored National Seminar, Distinguished Professor Award at ADST-sponsored Conference, and the IPA MP State Award. Also awarded for Best Promising Research in Pharma Anveshan 2023 organized by Pharmacy Council of India, New Delhi, are a testament to her impact and excellence. Dr. Malviya holds many patents as well as design patents related to pharmaceutical formulations and instruments. Known for her organizational and leadership skills, she has successfully directed numerous scientific events, symposiums, and seminars, serving as a dynamic coordinator for IPA and APTI state and national level activities. Her contributions extend to consultancy and training programs for pharmaceutical institutions and industries as well as engineering and textile industries, reinforcing her stature as a leader in pharmaceutical education and innovation. Ma'am, we are honored to welcome you as the convener and coordinator in the AICTE-sponsored Atal FDP at Modern Institute of Pharmaceutical Sciences, Indore. We sincerely thank you for gracing the occasion and shared your valuable insights on inspection and quality assurance of next-generation medical devices, leveraging AI to ensure safety, efficacy, and compliance, and contributing to the enrichment of our participants. Your presence is deeply appreciated. Her presence and expertise have greatly enriched our participants and elevated the spirit of this program. Thank you, ma'am, for your inspiring leadership and unwavering support.
So, good evening to one and all present here, esteemed dignitaries, distinguished guests and participant. Welcome to third day of Atal FDP. Welcome back, everyone. Indeed, we have been already progressing a rich journey of learning with distinguished panels of experts joining us every day. We are confident that your experience will be even more insightful and rewarding day by day. While it is not feasible to engage one-to-one discussion with 447 participants, rest assured to that this platform, we are trying to offer you best session through AICT Atal FDP faculty program sponsored by AICT, designed to foster a meaningful interaction, quality learning, and collaborative exploration. Reflecting on yesterday's session, it was clear that we sparked something special. The depth of discussion around medical devices not only fueled curiosity but inspired meaningful dialogue Our team is continuously getting positive responses via emails, WhatsApps from participants and dignitaries expressing their appreciation and eagerness to explore further. With this energy still buzzing in our mind, let's get together with fresh excitements and shared commitment to make this day's session even more enriching. Let's build on momentum, challenging ideas, and collaborate with open mind and inspired heart to learn more about next generation medical devices. Today's session, we have Dr. Nitesh Kumar Jain, Professor and HOD Pharmacology from Modern Institute of Pharmaceutical Sciences, which is the host institute for Atal FDP, and Mr. Anuj Yagnik from Piramal Health Care SEZ Indore. Let's continue to learn, grow, and innovate together. Your presence as a participant adds immense value to this collective experience. Thank you for your feedbacks and appreciation. Your participation across the nation matters a lot for us. Thank you for joining and join us till end to get an enriching experience. Thank you all.
Thank you so much, ma'am, for inspiring words, for setting the direction for today's session. Our first session of the day will be delivered by Dr. Nitesh Kumar Jain, sir, Professor and Head, Department of Pharmacology, Modern Institute of Pharmaceutical Sciences, Indore. Sir is a distinguished academician and researcher with nearly 2 decades for experience widely recognized for his contribution to pharmacology, toxicology, and international collaborations. Today, he will be speaking on the theme Smart Implants and Wearable Devices, Advanced AI Innovation. This session will explore how artificial intelligence advancing medical implants and wearable devices, enabling personalized monitoring, predictive healthcare, and improved patient outcomes. Now, I request our technical team to please play the AV for the induction of eminent speaker.
A warm welcome to the Faculty Development Program on Next-Gen Medical Devices, a fusion of artificial intelligence and 3D printing, sponsored by Aicte Training and Learning, Atal, FDP Academy. Dr. Nitesh Kumar Jain is a distinguished academic and researcher with over 17 years of experience in pharmacology and toxicology. He presently serves as Professor and HOD, Pharmacology at the Modern Institute of Pharmaceutical Sciences, Indore, and is also a visiting professor at Centro Escola University, Manila, Philippines. He has an outstanding research portfolio with 3 granted patents, more than 185 research publications, 13 Indian patents, 6 authored books, and 16 book chapters with reputed international publishers. He has guided 11 PhD scholars and over 65 postgraduate students, making significant contributions to research and academia. Internationally recognized, he has delivered plenary and keynote addresses in countries including the Philippines, Thailand, Australia, Malaysia, Egypt, and Dubai, with expertise in AI in drug discovery and toxicology. His leadership extends to organizing several national and international conferences and working with regulatory bodies such as UGC, AICTE, NAC, and PCI. In recognition of his exemplary work, he has received several prestigious awards including the IPGA Diligence Award 2024, Eminent Professor Award 2023, and the Academic Brilliance Award. Beyond research, he is deeply committed to social causes, promoting rational drug use and community health awareness through seminars and drug information services. He is truly an inspiration, exemplifying academic excellence, leadership, and social responsibility at both national and international levels. Sir, we are honored to welcome you as the eminent keynote speaker in AICTE-sponsored Atal FDP at Modern Institute of Pharmaceutical Sciences, Indore. We sincerely thank you for gracing the occasion and sharing your valuable insights on smart implants and wearable devices, advanced AI innovations, and contributing to the enrichment of our participants. Your presence is deeply appreciated.
We are delighted to have you, sir. Sir, we request you to kindly take the session forward.
Thank you so much, Dr. Bhagatri, for nice introduction. Just so good evening, everyone. Ladies and gentlemen, it's really a great pleasure to be part of this AICT sponsored faculty development program on next generation medical devices. And especially we are talking about the fusion of AI and 3D printing. So before starting, first of all, I'm very thankful to the Honorable President, Mr. Arun Kharia sir, Honorable Chairman, Dr. Anil Kharia sir, and respected HOI and coordinator of this wonderful faculty development program, Dr. Sapna Malvi ma'am, for giving me this wonderful opportunities for speak on smart implants and wearable devices, advanced AI innovation. Dear pharmacy teachers, PhD scholars, and entire fraternity, and I'm also thankful to the core committee, co-coordinator of this event, Dr. Namika Singh, and co-committee, Dr. Ashok Koshta sir, and Anko Joshi, Bhagsri ma'am, and all the committee members. They are working hard for making this FDP so productive, and definitely this platform will help you, all the teachers, for bringing our pharmacy education and research at next level. And we are very much supported and directed by our respected HY coordinator of this FDP. She has given a lot of insights in yesterday talk, and she has given a lot of things on the quality measurements, especially we talk about the AI and 3D printing. Ladies and gentlemen, as I'm delivering many lectures on the AI since long and all the part of country, and we are receiving many feedbacks from the faculty members, PhD such as scholar and PG students also, that they have tension that AI can replace us. So believe me, on this wonderful and beautiful platform, I would like to give one message to the entire community of the healthcare professionals that AI cannot replace us. AI cannot make medicine, right? AI can give some predictions about the target identification, about the molecular modeling. We are using many softwares and all. AI can speed up the drug discovery process, and with the help of AI tools, we can do something better. And even with the help of AI and 3D printing, we can remove the poor candidate from the research. So this is my personal opinion. If anybody has hesitation that AI can replace us, so believe me, AI has something big in near future, because all over the globe we are talking about the artificial intelligence and 3D printing now. But for Indian community, I would say that apart from the AI, all Indian research scholar, faculty fraternities, and students have the beautiful heart. That is, EI means we have emotional intelligence. So with the help of AI, we can do something better. But that's why, because we are making medicine. We are the part of the most sincere community of the world, that is health and science, and basically be involved in making medicine. So we have to always talk about the safety, efficacy of the medicines. Since beginning, since last 2 days, we are listening from all the speakers, from Dr. Salil Jahabi from Egypt, Dr. Ankush Sharma from USA, Dr. Vivekanand Chatap sir, our respected HOI, Dr. Sapna Malvi ma'am, has given a lot of insights on the AI and 3D printing and different part of different fields in the drug discovery zone. Today, I'm talking about the smart implants and wearable devices, and especially after AI innovations. And we have seen a lot of changes after COVID-19 pandemic. And believe me, now this is a proud moment. And really, I appreciate the efforts which is made by our scientists, teachers, pharmacy academicians, healthcare professionals. Then we made that vaccines. That's why we are here. We are talking to each other. In that particular level, when we have faced biggest medical emergency, that is COVID-19 pandemic, and that was the U-turn, especially for Indian pharmaceutical industries. I will talk about the current era, and current situation. And really, believe me, and it's really a great honor that I am on this particular platform and I am interact with the galaxy of intellectuals, those who are really working hard for this profession. So with the help of this platform, we can learn something better in terms of technology. With the help of technology, we can give something to the mankind, but especially I'm requesting you all the paternity which is related to the pharmacy, healthcare and all. We have to work for the sustainability. Sustainability is more important because I'm the man of pharmacology and toxicology. So I always look forward, apart from the pharmacological screening, screening, or maybe a therapeutic response, we must focus on the toxicity study. And I will discuss moreover on that particular part also. As we have getting a lot of insights on the 3D printing since last 2 days. So moreover, I will focus some other aspects of the smart implants and wearable devices. So ladies and gentlemen, coming to the so this is a proud moment already discussed by many speakers, but I would like to highlight these things that this is a proud moment for all of us. India become pharmacy of the world. This is not a line, my dear friend. This is something, a respect which we are receiving from all over the globe. Now, India's booming pharmaceutical and medical devices industry is not only a great source of innovation and employment generation, but has also become a global healthcare provider. During the COVID-19 pandemic, India has shown exemplary work on international cooperation by sending valuable medicines, medical devices to many countries. So now India is now the world renowned for its pharma innovations and for producing quality medicine at low cost. Today, as we are focusing on my talk, that is smart implants and wearable devices. So this is very interesting. Always we talk about the drug discovery and all. But we are the integral part of the healthcare system. And again, I'm requesting you all, we must concentrate on the interdisciplinary research, which will focus and which will need the help of many doctors, pharmacy officer. Always we are ready to help them. And after COVID-19 pandemic, we are getting that appreciation from all over the globe. Recently, I visited Philippines and really they have appreciated the work which is done by the Indian pharmaceutical industries. And because of now India become pharmacy of the world, now each and every country looking towards Indian pharmaceutical industries for making quality medicine. And definitely we are providing that. So it's again requesting on this international platform, we have to work hard and we have to maintain this tag, respect that India now as pharmacy of the world. Now every countries are looking and giving so many things to the India. And believe me, now India become fourth largest economy of the world because of pharma. So we all must proud, and really I'm giving big clap for each and every one, those who are working hard for this profession, for upliftment of this particular Indian pharmaceutical industries. And we, academia and industries, we must work together. After my talk, we have one speakers from the industries only. So he will give light on that another part. And those who are from the industries, I'm requesting that we are the both pillar of this particular house, beautiful globe, and we have to work gather so that we can give something to the mankind which may have socio-economic impact. Now, this is a time, this is an era where everyone has to share their thoughts if we are working that. And this thanks to COVID-19 pandemic that they have given this wonderful Zoom platform, and we are sharing the thoughts. We are connecting almost 447 participants, and really it's a great honor for me. So now we always proud to be Indian and become the member of Indian pharmaceutical industries. Why pharma industry and in India? So you know that greenfield industries where the sun never set. We have a lot of scope in Indian pharmaceutical industries, apart from the roti, kapra, and makan. But the fourth essential things, that is medicine, touches every human life and creates wealth for the beautiful world. As already said by Dr. Sapna Malvi, ma'am, India is 13th in sales value and third in the volume numbers for the drug production and supply. So, my dear academicians, PhD research scholar, and other participants, we have to work hard and we have to maintain this the dignity of the India to provide quality medicine. And believe me, now things has been changed after COVID-19 pandemic. Every country and this beautiful globe are looking for quality medicines from the India. And soon we will become the third largest economy of the world. And believe me, we all will play a major role for making India as third largest economy of the world. Then we will be the superpower of the pharmacy because of the hard work, dedicated work of all the academician, industrialists, and our research scholars also. So I must say AI is rapidly transforming clinical trials and research, offering numerous benefits like improved efficacy, reduced costs, faster time to market for new therapies, next generation medical devices. AI is used in various stages from initial drug discovery and target identifications to patient recruitment, data analysis, and regulatory compliance. Now you can see the market of Indian pharmaceutical industries. This is the expected growth. And being a teacher, we must motivate all the student, research scholar that the things has been changed. Previously, we are seeing the things and we are lacking about the like positions in the good package in Indian pharmaceutical industries. But now things has been changed. Every industries are believing to increase the export. That's why they are looking manager, team leader, country head. So we have to give some advantage in terms of technology, what we are discussing since last 2 days, and we will discuss till 6 days, and many speakers will come. So the Indian pharmaceutical industry is often called pharmacy of the world, is a significant global player now, valued at around USD 55 billion and projected to reach USD 120 to 130 billion by 2030. So my dear teachers, my dear friends, you can see the growth by 2030. Again, we will become the superpower, especially in terms of pharmacy. And thanks to Honorable DCGI, Dr. Rajiv Singh Raghuvanshi, sir, he has really changed. He is the man who has changed the image of Indian pharmaceutical industry in the entire world. And always he said, I have remember when we have meted in one IPA conclave, he always tell us in every situation that please do the proper compliance in pharmaceutical industries. Don't go for the shortcut, because if you are going for the shortcut, definitely the things will come with the failure in the maybe in future. Because whatever we are making, we are saving the life of many, right? We are dealing with the medicine. We are dealing with the life of mankind. So we have to focus on the safety part, efficacy, and quality medicine. If you are making one good medicines and if you're doing good, definitely you can earn a lot of money for a long time. I already told that we must focus on the sustainability as United Nations goals 3 and 4, which are basically focusing on the safety and efficacy and sustainability. So if you're thinking for the sustainable development of the drug discovery and medical devices, believe me, trust me, whether you are in a company, you will get regular growth, complete growth, and you will feel something in your heart that we are making something. As I already told you that world have AI, but we have EI. All the Indian pharmacy fraternity and other healthcare professionals have a beautiful heart, and that heart can never think for making a wrong medicine, right? So we have to focus on that particular part, especially if we are talking about any medicines, any drug discovery, we have to focus on the sustainability. We can go for the reverse pharmacology now, new era. There are many software applications as we are discussing since long, computer-aided drug design software, molecular modeling, bioinformatics. There are many fields. And now AI is playing a major role, my dear friend. AI can give a lot of data to you. Our brain can analyze definitely, as Dr. Kadab sir said yesterday, that human brain is more important. Whatever we are making, is they are making some kind of algorithm. On that basis, we are assuming something and we are focusing on the target identifications and all. So basically, we need to understand what's going on in the Indian pharmaceutical industries, and moreover, and now India become pharmacy of the world. So we have to focus on sustainability. So as I have taken a new interesting topic, that is medical implants and wearable devices. The integration of AI into medical implants and wearable devices is revolutionizing healthcare by shifting the focus from reactive treatment to proactive, personalized, and predictive care. Now, AI-enabled implants offer real-time monitoring, adapted therapy, and improved biocompatibility, while wearable devices provide continuous health insights that empower patient and clinician alike. My dear friend, implantation we are using since long. Now we are talking about these smart implants with the integration of AI. So what AI is giving something which can analyze, interpret, and we can make some algorithm so that we can remove the poor candidate from the research. And if we are making implants, if we are making wearable devices, whatever materials we are using, we have to check the quality for the safety and efficacy about the next generation, future generation. So we have to come up with the technology, right? So together they bridge the gap between advanced technology and patient-centric medicine, ensuring early diagnosis and optimize therapy and enhance quality of life. If we talk about the implantable medical devices market, my dear friends, you can see the tremendous growth. And we have to come up with the current era. That is called market research, where our market is going. According to that, if we can train our students, research scholars, that you can go in that way. Like there are many companies who are making medical devices. Those students who are in PG or maybe in UG, it's my request to all the teachers, they can motivate them about the new era, about the new field where they can go and they can get a good package and as well as the good positions also. So you can see the global medical impact market. This is the expected growth. You can see 2020 to 2032 USD billion, almost 6.7% growth we will see. And that is the forecasted market, about $177 billion. So this is the big market, and where we can send our students. And believe me, trust me, AI is not a big deal. AI is just a tools, right? Don't take in any other way. This is a tools what we are using. And believe me, all pharmacy fraternity using these tools since long. But after COVID-19 pandemic, now the things are in on applications. Previously, we are using QSAR, molecular modeling, computer-aided drug design software also for at a small level. But now we are using at large level. So this is the market. We talk about the global industries. If we talk about the current era, if we are talking about the AI integration with the smart wearables, you can see FDA-approved AI health wearables. Now you can see the devices like Embarrass 2 now feature neurology-specific AI algorithm with 100% detection accuracy in clinical trials. It is also helping in clinical trials. That is the reference from today's medical developments. Advanced bioelectric wearables, AI-equipped sensors now monitor vital signs, including heart rate, as you have seen the glucometer for diabetes measurement, oximeter, heart rate, glucose, biomarkers in sweet intestinal fluid, and real-time paving the way for early detection and personalized care. And if we talk about the third one, that is microfluidic wearables, if we are combining with the AI, you can see the microfluidics and sensor data like sweet and tear fluid. These devices enable non-invasive continuous monitoring healthcare, especially in Europe. Predictive healthcare tracking, researchers at the University of Arizona are using AI and wearables to forecast labor onset, detects stress before visible symptoms appear. So that is the research from the Arizona Health Science. Real-world anomaly detection, that is AI in the pulse system uses wearables ambient sensor to learn each individual's physiological patterns and raise personalized health alerts with around 22% boost in accuracy and offer interpretable things. If we talk about the smart implants, innovations under skin, we are seeing the implantations, and that is on the syllabus also, especially we are seeing in each semester. But now if we are integrating with the AI, you can see some wonderful changes. If we talk about the wireless magnetic implants, from Peking University, these teeny magnetic sensors without wires, bulky hardware can measure intracranial pressure, glucose, and cerebrospinal fluid viscosity, demonstrating real-time sensing potential. So again, this is a big achievement, especially for the cerebrospinal fluid viscosity measurement in brain. Automated glucagon implant, that is MIT researchers develop an implant that release glucagon when blood sugar dips dangerously low, like a built-in emergency response of diabetic at risk of hypoglycemia. As we are seeing so many diabetic patients, so these kind of sensation, these kind of implants are helping a lot to understand, to monitor the real-time analysis, especially with these smart implants. Assistive neurotechnology with the AI, a dual loop system integrates AI wearable devices like smart glasses, watches we are seeing everywhere. Now smart watches are in trend with the neural implants to detect environmental triggers and provide on-demand stimulation, target for PTSD therapy and rich brain behavior data collection. So these are the current domain which we are discussing. You can see the different wearables and implant medical devices typically used in precision healthcare system. So all we are aware about these things. If we talk about the wearables like a smart glass, fitness band, pacemaker, glucometer, intelligent sensor, biomechanical soul. And if we talk about the implants, that is neurostimulator for nerve stimulation, cochlear implant for ear, pacemakers for heart, neurological stimulator, insulin pump we are using since long, and artificial knee. This is basically what we are seeing, that is the application of AI and 3D printing. So this is the model. You can understand AI evaluations after advancement in AI and bettable track, just like basic algorithm. Believe me, whatever inputs we are giving to the machine, that's why I'm saying you have to interact with some computer science engineers also, biomedical engineers also. If you are going in that particular domain like smart implants and biomedical devices, don't think that I am the man of pharmacy, so we will make only medicine. Please, we are the part of the healthcare system. We can give some better inputs because we are the specialists of medicine. We know about the receptor, we know about the molecular mechanism of the things, right? So that we can guide to the computer engineer, maybe biostatisticians and all other part of that, so that they can understand what you want, because the inputs whatever will come from the pharmacy fraternity, that will help a lot to making these kind of biomedical devices also, because we need to understand whatever evaluations or sensor innovations are coming, how they are connecting, how smartwatch will work, how they will get the senses, and how the signal will come. As we know that body has two messenger, primary and secondary messenger. So accordingly, they will convey the message in the particular devices. If we talk about the wearable devices or maybe implants, they will take the sense, and that sense will be converted into the data. So as we are using smart watches for making like BP and heart rate, and for glucometer, we are using to check the sugar level also. So with the help of this advantage, we are going in everywhere. And if we are the pharmacy of the world, so we have to work with the technology. If we have to supply medicine to all over the globe, we have to come up with the technologies. Manpower is very, very important. Again, I'm saying AI cannot make medicine. But the tools, whatever we are talking about, the AI and 3D printing and many more, we are using, so we have to use. But sometimes we have to integrate with the safety and efficacy of the data that we will discuss in the separate part. So improve predictive analysis for early disease detections, and a smaller, more accurate sensor enable diverse health monitoring, and seamless integration with the 5G and IoT for adaptive system. So this is the advancement. You can see the particular domain, or we can the modules, the wearable sensors, how AI ML assisted POCT devices. So there are many devices already we have seen in the hospitals, even in our home. We are using for the diagnosis, treatment, monitoring, and absolutely for the safety. If we are going, we cannot go all the time hospitals. If we have something to analysis in the home, sometimes those who are suffering from hypertension, diabetes, or maybe some other chronic disorders, so it's not possible to them for always we have to keep in the hospital. So sometimes we can monitor our things, what's going in the body. According to that, we can consult with the doctors and all. So this you can see the ECG, ESG, and prosthetic eye. So this is the something, and obviously the body is responding for the signals, and we are getting some signals like the spinal cord is giving message, and we have two poles ascending and descending loops. So sometimes that's where they're using for the wearables devices and all. You can see the different features, how different fibers, nerve stimulation can help you for understanding the wearable and implantable, how they process, what kind of things they need. We'll discuss. So this is the state-of-the-art wearable and implantable devices, a flexible sensor array. You can see how we can wear all these things. This is the man hearing aids, the smart pacemaker also. This is the big achievement of the healthcare world. We are coming up with the technology. An electronic skin, smart watch for health monitoring. This is very common trends now everywhere we are seeing. Classification history of wearables already we have discussed. This is the small picture through which you can understand in a better way. So cardiac dysfunction in COVID. So in COVID-19 pandemic, everyone was in the house and there was no space in the hospital. So at that time, the U-turn was happened with the digital technology. Now nobody know about the oximeter like before COVID-19 pandemic. Now everyone, even the small childs, also know about the what is oximeter, what is glucometer, and everyone was thinking about that the lungs. Nobody's thinking about the heart in COVID-19 pandemic, right? So these were the species and these were the advancement was what we are seeing in especially if we are talking about the AI and 3D printing, right? So this is the fundamental you can understand what is the composition of implants and maybe wearable devices. So if we are focusing on the brain, heart, or maybe the abdomen and other part of the body. So this is the basic fundamental what we need for making medical devices, especially we are talking about the smart implants and wearable devices. The skin magnetic implants, what we need, they need vibrations, cavity, elastic membrane, encapsulations, how we can go for the integration with the sensor. So basically, the main role of the sensors to detect the signals, and it is going to convert it into the data, which we can see in that particular devices, how our body is working, what other organs are working, what is the anomalies, what we are seeing. So these are the advantages. And believe me, AI is playing a major role, especially in the diagnosis of the disease and disorder, as we are seeing drastical changes and the advancement in the like MRI scan and CT scan, and we are seeing many changes, upgradations in the technology. We can see the complete picture of the body by using these medical devices. So this is the application of non-invasive smart plants. Prosthetic implant you are seeing nowadays, we are using at large level interbody cage implant, polyethylene insert, rod sensing implant. And we are using for orthopedic surgery, implantation is very, very important, especially in dental also. And heart disease, we are using implantable cardioverter defibrillators, and coronary stents are very common. Now we are seeing the many cases also. So in hospitals, you are seeing the many machineries who are observing every day, every minutes. On that basis, doctors, nurses are deciding the treatment, and our pharmacy fraternities is playing a major role. Because I already told you that I salute to all the pharmacy fraternity, those who have given something better to the society, mankind. And if we're talking about the at global level in COVID-19 pandemic, really we are receiving a lot of respects from the all over the globe. So glaucoma, neurological disorder, diabetes. So this is something what we are using. So in everywhere, AI is playing a major role. And here we are talking about the, where we talk about the patient report, analysis, monitoring, if we talk about the diagnosis, if we talk about the medicines, if we talk about the pharmacovigilance, clinical research, everywhere we are using artificial intelligence. And that is somewhat very essential to learn. Don't go away from this technology, otherwise the future will go away from you. So we have to adopt the technology. With the help of technology, we can help a lot globally, internationally recognitions that we got. So we have to maintain that particular respect. And now we have to focus on the sustainability. This is my personal request from each and every one, that we have to work on the sustainability. Don't go for the shortcut. Sometimes what we are seeing in the drug discovery, that some of the companies are focusing on the short-term goals. They're not focusing on the long-term goals. So I'm requesting all the industrialists who are attending this FDP that we have to work on the toxicity profile also. Sometimes what's happened, we can do like acute toxicity and maybe subacute. But sometimes if we are using medicines for a long time, maybe medical devices for a long time, so we have to go for the chronic toxicity study so that we can analyze the proper efficacy for the long-term use of that medicine or maybe medical devices or any other healthcare services, whatever we are going to provide for mankind. So we have different regulatory body and we have a lot of pharmaceutical challenges for taking approval. So now I already told you that our Honorable DCGI is taking a right step and he is saying only one thing: please follow the proper compliance to making quality. This will give something good for your industries for a long term, for a sustainability. That is the real-time requirement. Sustainability in drug discovery is crucial due to the high environment and financial costs associated with the development of new medication. Suppose, for example, you have made one medicines with the help of AI and all, right? You have developed a wonderful medicines and it is showing a good effect for the treatment of liver. But at the same time, after use for a long time, if it is going to create some, not at all. So we have to focus on the toxicity studies. AI can give prediction. AI can identify the targets for you. AI can remove the research poor candidate from the research. That's why in previous era, we take 14 years for making drug discovery or maybe anything, right? But now we are coming up with this 7 years or maybe 8 years just because of technology. But technologies are playing a major role, but at the same time, if you are making medicine, if you are making medical devices, this is something very important for the life of the patient, right? So the integration of AI in medical and pharmaceutical sciences has been instrumental in addressing the challenge posed by the COVID-19 pandemic, and its impact will continue to shape up the future of healthcare. This is the era. This is already I have discussed. The 2020 was the year the entire industry has been changed. The image of pharmacy fraternity has been changed globally, believe me. So we are using the technology and we have to use the technology for the fulfillment of the requirement, the need of global populations. They're looking for India for making beautiful world, and we will play. And I have a full faith on all the fraternity, my colleagues, my seniors, and my honorable dignitaries on this particular platform, that we have that potential. India has that potential that we can make happiest world by providing quality medicine with proper efficacy and safety. So this is the model what we are using in drug discovery or for making medical devices, right? So why AI in medical and drug discovery? So again, we have to work hard for making better input variables. We talk about it like genomic, DNA, RNA. Maybe we are using clinical variables from the hospitals, from the medical records, and we can go for the extraction and selection of that information. That is very, very important, right? And the machine learning that I already told you, that we have to meet with this person who are expert in machine learning, maybe a computer engineer, who can make some algorithm for you. If we are giving some concept, we are giving some input variables, he will definitely make good learning. So while making input variables for a particular set of problems, for medical devices, for a disease and disorder, we have to work hard. So these are the part of your AI sequencing analysis, medical bioinformatics, biostatics, machine learning, and all, right? Computational biology, genomics, proteomics, transcriptomics. I know that there are many faculty members, research scholars who are working on the different part of AI sequencing and applications. So we have lots of role in every situations. If we talk about the system biology and all. So this is the biological signals transaction and digital data augmentation. If we are talking about the smart implants and especially wearable devices, so this is the fundamental how they are working. So material science, we are using 2D materials and biological signals transactions, like if we are using in the heart, there are some secondary messengers who will give signals to that particular device, and that particular reading we can read on that particular digital screen. How your BP is going to increase, what is the heart rate, what is the sugar level right now. So self-diagnosis is possible with the AI tools and integration of 3D printing also. So 2D materials based smart wearable devices now in a great trends, and we are using electrical signals, collecting raw data. So these are the things which are using. So AI-driven wearables, biometrics in digital healthcare. Foundations technology like wearable sensors, making AI algorithm we need it from the experts, energy efficient computing, flexible and blow compatible materials. And basically we are using in the health monitoring, disease diagnosis and personalized treatment. You can see that drug discovery is a very complicated process. It's required a lot of efforts. Believe me, now AI is playing a major role. AI is decreasing the cost as well as time for the drug discovery. So this is the biggest achievement, and I really salute. But again, I'm saying we have to use this AI with the proper authenticity and whatever data we are collecting, because Google Devta can give anything to you. So don't rely on Google Devta. We have some authentic sources from where we can get the proper information, and on that basis we can discuss, we can identify, we can optimize the target and all. So overview of AI in pharmaceutical sciences, I already discussed that we can enhance the decision making by leveraging the predictive algorithm, reduce the time and cost for drug discovery and for making medical devices also, and we can improve the accuracy also. These are the some software whichever we are using in drug discovery, as well as these we're using for the medical devices company. So there are some software, Aprigo, Phenomic AI, Structura. They're making and they are helping to identify the proper drug target. Even they can identify the RNA sequencing, DNA sequencing, and how your structure of that particular things is going. This is the something which we can learn, we have to learn. So those who want to go in like medical devices or maybe are making some AI tools, we have to learn some languages like Python. So this is the sequencing, how we can make, this is a trend model, we can make some models. The MSME is giving so much fund that Modern is also receive as addressed by our respected HY, Dr. Sapna Malvi ma'am also. So now government is giving a lot of funds to you. If you are going to develop some medical devices, you have to make a prototype, you can get a lot of things. But firstly, we need to understand the basics of the algorithm, input variables, and the language, whatever we are using for making these tools. So yeah, innovations for sustainable smart implant, that is very, very important. Again, I'm saying, so yeah, enhance the sustainability for smart implants, internal medical devices with sensors and microelectronics by improving patient outcome and devices long durability. So sustainable materials we need. Again, I am saying that if we are making something, we need to understand. If we are using for long-term toxicity must be measurable for the devices, for the drugs, for the chemicals, each and everything, so that we can make something good for the mankind and it will be useful for a long duration and it will give long-term benefit to your company and as well as to you also, right? So biodegradable alloys and polymers, so resorbable implants made from the materials like polylactic acid, PLA, and polycarbo lactone, that is PCL, can dissolve safely in the body. So after fulfilling their purpose. So this is very important, my dear friend. What we are using, what will be the last time impact, how it will create some issue, and then we need to understand what can be the toxicity of that particular material. So this innovation eliminates the need of removal surgery, reducing patient risk and carbon footprinting of the additional procedures. Bioactive coatings is very, very important. AI is used to design and optimize biocompatible coatings that improve implants integration and reduce the risk of adverse immune response. This is very, very important. Those who have autoimmune disease, or you know better that many of persons having weak immune response. So if we are putting any implants, it may act as a foreign body for that particular things, and you can have that another type of issues. So this enhances the implant's lifespan, preventing the need for revision surgeries also. AI-driven optimizations, we need predictive diagnostics, personalized treatment, and energy efficiency. So these are the some tools which is very, very important. So whatever we are making, if we talk about the medicines or the devices, we have to go for the proper optimizations. And yesterday talk already, Dr. Sapna Malvi ma'am has given a lot of insights about the different guidelines about the optimizations, efficacy, and safety. So what are the challenges and future outlook? So while the integration of AI into smart implants and wearables presents significant opportunities for sustainability, it also includes key challenges like data security. This is very, very important. So data security, the collection of vast amount of sensitive healthcare data from wearables and implant create cyber security and privacy risk. This is very important. Secure features like blockchain and federal. Just a minute. So ethical consideration also. So AI algorithm trained on biased data set could lead to the healthcare disparities, ethical oversight, and diverse. So we need to concern this ethical consideration also. Regulatory hurdles. There are many regulatory body evolving regulatory policies for AI-driven medical devices can create complex approval process that hinder widespread adoptions. Energy consumption is very, very important. While AI can optimize energy, the advanced processing required for AI models demands significant computational power, creating a paradoxical energy cost also. So we have to focus on that also. Now we are coming for the very interesting, and this is my favorite area of the research, toxicology in drug discovery and next-gen medical devices. Everyone is talking about the, drug, medicine, devices and all. But my dear friend, my dear pharmacy academician, researchers and all the dignitaries, I'm requesting now we have to focus on the toxicology, because the entire fraternity of the globe, we are seeing the role of toxicology is playing a major role now. So toxicology serves as a bridge between innovation and safety in both the drug discovery and medical devices. Its role spans from the early predictive screening to regulatory compliance and environmental sustainability. Integrating toxicological science, computational models, and ethical practices like 3R principles, researchers can ensure the future drugs and medical devices are safe, effective, and sustainability. We are working on that particular mission, which we are focusing, that is the sustainability. We have to include in pharmacy, drug discovery, or pharmaceutical sciences, or we are talking about the medical devices also. So the main theme and thing what we want to convey on this platform, we have to focus on safe, effective, and sustainable drug discovery. This is the fact that we are made up of the chemicals, and we consistently interact with the chemicals made by the nature and man. So all chemicals have the ability to be toxic, right? We must breathe. We cannot breathe, right? If we want to survive, we must breathe, we must drink, we must eat chemicals to stay alive. The air we breathe is a mixture of chemicals, water, milk, beverages, and chemicals. Our food contains variety of ratio. You can see the examples of the toxicity. These two fruits are very famous everywhere, pomegranate and orange. This is the source of vitamin C. If we are using very little, that is essential for biochemistry. If we are using 50 mg, that is the daily requirement for physiology. And if we are using 500 mg, that is for the treatment of common, that is called. And if we are using more than 500, more than 5,000 mg, it may cause kidney stone. It's really very panic. I think nobody is thinking about it. Very few people know about that vitamin C can cause kidney stone. Now we are seeing the many cases of kidney stones, right? So everything can be toxic. This is the matter of the dose, the quantity, whatever we are taking. So that's why whatever we are making, if we are making medicine, if we are making nutraceuticals, if we are making some essential things, or maybe like, so whatever things we are using, you need to check the toxicity of the each and every compounds, chemicals, materials, whatever we are using. Maybe one drug cannot cause side effect, but if we are combining, like this is the era of fixed dose combination, and always FDCs was this is a hot discussion maybe about that we have seen so many generational fixed dose combinations in the Indian market also, right? So we need to understand what can be the cause of the toxicity. This is the very rational of targeting that FDP I've attended previously. This is the source for Dr. S.P. Vyas, sir. So that's why I really salute him that he is thinking in that way, the things, the rational of targeting. Our body is so much complicated. It contains so many tissues, organs, and all, right? So it's very, very difficult to target the proper site if we're talking about the cancer. So always we need non-target sites. If we're talking about the implants, if we are talking about the medical devices, definitely they are playing a major role. Now we know about the cancers, the metabolic pathway of both these cells are same, so it's very difficult to target. But our scientists are working hard and we are reaching and we have already increased the life span as almost for the cancer patient if we talk about the previous era. This is the fundamental of concept of targeting. So this is the visualization effect, what we can achieve from the AI. We can explain to the students. So I'm requesting all the teachers, we can make some 3D pictures. We can make some videos like this, right? So size does matter, how it is going to cross the blood vessels, and we have two target and normal cells, how they are going to into the bell, how they're targeting the cancers. If we are making long circular nanocarrier, they are easily crossed. You can see in the second one. So we have to understand this mechanism. If we are making targeted nanocarrier, then only we can achieve the properly curable treatment for the cancers. You can see the role of receptor. If we have targeted cells, if we have a proper receptor, drugs will bind and it gives a proper direction. If we are going for the target, if the cells don't have that receptor or maybe the target protein, it will go into it may cause less toxicity. Common ground drugs and medical devices, we have to go for the risk assessment framework like hazard identifications. We have to check the dose response, exposure assessment, and risk characterization. Patient safety first. This is the main motto of each and every pharmacy officers. Ensure efficacy is not compromised by toxicity. Regulatory alignment by the FDA, EMA, and ISO standards. Integrated toxicology in product approvals. That is necessity. And sustainability and the green practices also reduce toxic wastage. Role of toxicology in medical devices. You can see the different parameters. Biocompatibility assessment is very, very important. Ensure device do not cause cytotoxicity, irritation, sensitization, hemolysis, or genotoxicity, governed by ISO. Medical safety evaluations like polymers, materials, whatever we are using, and extractable leachables like testing, that is very, very important, critical for implants, infusion system. Nanotoxicology devices is very, very important. Environmental and occupational safety. I'm not going on the deep because we have another speakers also. So we are giving a short information about that, but this is something, this is very, very important if we are making anything. So in clinical trials also, we are using these implants and wearable devices for the early detections, speed up the drug development, monitoring clinical research, patient recruitment, personalized medicine. Everywhere we are using this. So AI in clinical tests, this is the very interesting. You can see the market dynamics. Challenges what we are facing and even in pharmacovigilance. Believe me, Now we are going to reduce the ADR reporting in India, but in previous era, especially in COVID-19 pandemic, we have seen a lot of ADR reporting from the Pharmacovigilance Center or maybe IPC and PBI. So we have to focus on the challenge like privacy concern, encrypted data, structured data, machine learning algorithms. So whatever we are making, this all depend on the data. So globally in pharmacovigilance market research report, you can see the every multinational companies are using. These are the some techniques we'll not discuss in detail. Our other speakers are more focused. So we are using lots of technology with the AI. So again, I'm saying that AI is very, very important. That is ethics and artificial intelligence in medicine. As I already told you that we are making medicines for the mankind, and every mankind is very, very important for every family and even for us. And this is the duty of all the pharmacy fraternity. We have to provide safe and effective medicines to them. They deserve it. And whatever we are doing, we have to focus on the sustainability. So these are the some ethics and AI. Our Honorable TCGI is really a very dynamic personality who is giving a lot of things to this Indian pharmaceutical industries. And no doubt, we all pharmacy academician industrialists are working hard and we are supporting our DCGI, and especially you know better that they are taking many decisions for implementation of the new policies, and especially is requesting for the compliance. So you can see the various area reporting. Now we are going to decrease in 2025. So already Dr. Chattab sir has given a lot of insights on the various tools, so I will not focus that much. So AI and MS were repeatedly pharmaceutical science. So this is the conclusions from my sides. While challenges remain particular around the data quality, model interpretability, regulatory implications, the continued evaluation of AI promises to drive a sustainable and transformative shift in the healthcare research and development. We have meted in IPA in Indore, in IPA conclave. So you can see the pictures of Honorable DCGI with all the dignities of our Honorable Chairman, President. So he has given a wonderful message, and we have raised one question on behalf of all the pharmacy fraternity that why our pharmacy professors are not getting that package and all. He simply replied, you have come up with the technology, and definitely now things has been changed as India now got the tech that is pharmacy of the world. Now things has been changed and you will feel the changes, and definitely we are seeing the changes in Indian pharmaceutical industries. Now they are approaching quality faculty, quality professional, research scholar for making something good for the globe, beautiful globe. So the vision of everyone must be the beautiful world in which people are free from all disease and disorder. So again, I'm requesting you all, please come up with this particular vision, and definitely we will make something. And we are in the right profession. We are in the very noble professions where we are getting something, but sometimes we are giving something to the society. So these are the some glimpses from. So this is all about my presentations. So if you have any queries, and thanks for patience listening. And once again, I am thankful to the AICT for giving this wonderful opportunities. Thanks to the coordinator, Dr. Sapna Malvi ma'am, for giving this wonderful opportunities to interact with the galaxy of intellectuals from all over the globe. Thank you so much. Yes, over to you, Dr. Ramaki Singh, madam.
Thank you, sir, for such insightful and futuristic session. Your perspective on AI-powered smart implants and wearable technologies have truly expanded our understanding and how innovation is redefining healthcare delivery. Thank you, sir.
Thank you. Thank you so much. Thank you, everyone.
दो मिनट में भेज देती हूँ चेक बॉक्स In any case, any participant has question, they may post in chat box. So there's a question, AI software which we can use in research and academics.
Yes, Anush, thank you for the nice question. देखिए, in pharmaceutical sciences and drug discovery, we are using many software already. We talk about the previous era, we are already using CAD, molecular modeling and all. But apart from that, whatever we are using, that is Atom is very, very interesting software where you can get the genomic data, especially we talk about the DNA sequencing, RNA sequencing. That will help you a lot to identify the proper target. Because when we have seen COVID-19 pandemic, when COVID-19 was scam, nobody know about the structure and all. So on the basis of AI applications, especially Atom and maybe a Plexura, we have used many times for to identify the that target, because for every medicines we need proper receptor. If we are finding the proper receptor or maybe a target, we can find the better solution for that disease and disorders. So I will share the complete list on that particular WhatsApp group also, whatever we are using in drug discovery. And we have a different set of target, like if we are going for the target identification or maybe from proteomics, genomics. So we have different kind of software. So we have to use bioinformatics in a different domain, and we can use in that particular things. Yes, one more questions. Yes. Thank you. Yes, next.
Any questions? Okay, thank you so much, sir.
Okay.
So we are having another question.
Okay.
Please, sir. Why AI is only diagnosis and medicine, not for treatment like dialysis, as it is more painful process, so any scope?
Uh, I already told you in initially that AI cannot replace us. Why I'm saying this? Matlab, this has lots of meaning to all the pharmacy fraternity, because for everything we have to go for the practicals. Because we belongs to the most sincere community of the world, that is science. We have to work on that. AI can give something predictive analysis for making, like on the basis of data. So whatever algorithm we are making on the basis of data, that will help you to remove that particular impurities if we're talking about the toxicity and all. So ultimately, we have to work on that. We have some softwares also that can give some signals to you. As we are talking about the medical devices also, we can have some sensation. And I will suggest you to use biochemical and hematological parameters. If you are going for any kind of toxicity study, whether maybe genotoxicity, reproductive toxicity, maybe teratogenicity. So we have some initial signals from the biochemical and hematological parameters. Whatever extract you are using, whatever drugs you are using, you can go for the proper analysis with the auto analyzers also. So software can give something, and believe me, there are very less data available on the toxicity. So I'm requesting you on this platform, all of you have to focus on the toxicity. If anyone doing PhD or maybe PG, they have to focus on the toxicity studies also, so that they can give something better for the mankind for the sustainable drug discovery.
The next question is there AI integrated software which predict impurities of drugs which are genotoxicity or carcinogenic?
Yes, there are many, AI, what is AI? AI is a computational approach. We are making algorithm on the basis of data. So you can see the various healthcare guidelines, and we have lot of data with whatever we are going for the algorithm. There are many softwares. If we talk about the BG flow, you can see in the PBPI websites also. If we are putting any medicines or any drug interaction, drug food interaction on the PBPI, and BG flow is a software from where you can get the predictions about the any ADR, maybe related to the genotoxicity, reproductive toxicity, any kind of toxicity. We are talking about the neurotoxicity and all. So AI integration softwares are many, especially in pharmacovigilance. This is the full gamut of data only, right? Whatever ADR reporting from the different centers, they are going for the Uppsala monitoring centers. Finally, they are publishing through WHO. So on a single report, we cannot conclude that drug having some, adverse effect and all. But if we are approaching, if we are getting many reports from the different pharmacovigilance center, then only we can issue the notification that drugs must be withdrawn from the market. So there are many software, and especially we are talking about the pharmacovigilance. Already we are working on the software only. Thank you.
Okay, thank you, sir. We now move on to the next exciting and futuristic session that connect two of the most transforming forces of our times, artificial intelligence and 3D printing, which one of the most important pillar of any organization, its workforce. It gives me immense pleasure to introduce our next distinguished speaker, Mr. Yagnik, Senior HR Executive at Piramal Healthcare Private Limited. Mr. Yagnik brings with him rich experience in human resource management, talent development, organization growth strategies within the healthcare sector at Piramal Healthcare. He has been instrumental in aligning people, processes, and performance with innovation driving goals of the company. His expertise lies in not just managing talent, but in shaping it to meet demands of rapidly evolving industry. Today, he will be delivering his talk on the very pertinent theme, shaping the workforce of tomorrow, HR strategies, and AI and 3D printing in healthcare. This session will highlight how disruptive technologies are changing the way we design jobs, build skills, and develop leaders. We will gain insights on the HR strategy professional must develop to nurture adaptability, foster digital readiness, and create a workforce that thrives in this era of transformation. Ladies and gentlemen, please join me in giving a warm welcome to Mr. Yagnik as he takes us through his enlightening session. To introduce our speaker, I request the technical team to please play the AV.
A warm welcome to the Faculty Development Program on Next-Gen Medical Devices, a fusion of artificial intelligence and 3D printing, sponsored by Aicte Training and Learning, Atal, FDP Academy. Mr. Anuj Yagnik holds an MBA in Human Resources and an LLB Honours, further complemented by an international certification from Canada, which has added a global dimension to his expertise. This strong academic background has enabled him to develop a deep understanding of organizational behavior, people management, and the legal frameworks that govern human resources. He commenced his professional journey with the prestigious Taj Hotel, Mumbai, where he gained early exposure to the intricacies of people management, service excellence, and organizational culture. This formative experience laid a strong foundation for his career in human resource management. With more than 6 years of professional experience, Mr. Yagnik has cultivated proficiency in talent acquisition, learning and development, and HR operations. His work has consistently emphasized the alignment of human capital with organizational objectives, focusing on nurturing talent, enhancing employee engagement, and fostering a culture of continuous learning. Presently, he is associated with Piramal Pharma Solutions, Indore, a globally respected pharmaceutical organization. In his current role, he contributes meaningfully to strategic HR practices, workforce development, and organizational growth, ensuring that employees remain agile, motivated, and future-ready in an era of rapid technological change. Mr. Yagnik is widely appreciated for his people-centric approach, combining empathy with strategy, and for his commitment to mentoring young professionals. Sir, we are honored to welcome you as the eminent keynote speaker in AICTE-sponsored Atal FDP at Modern Institute of Pharmaceutical Sciences, Indore. We sincerely thank you for gracing the occasion and sharing your valuable insights on shaping the workforce of tomorrow, HR strategies for AI and 3D printing in healthcare, and contributing to the enrichment of our participants. Your presence is deeply appreciated.
We are delighted to have Mr. Yagnik with us. Sir, we request you to kindly take this session forward.
Okay. Hi, thank you so much, Anamika. Anybody can confirm, please? Am I audible to you all?
Yes, sir, you are audible.
Okay, thank you so much. So, first of all, I would like to thank you to the AV team for the very good introduction, and I would like to thank to all AICT team, Atal and Modern Institute of Tea for the organizing us such a good event, and I'm very glad to hear presenting a good HR expertise with my experience, with my domain, with the 3D printing and AI strategies in the human resource department, with the expertise of trending of the era. So, okay, just let me share my screen. Kindly confirm if my screen is visible.
Yes, sir.
Yes, sir.
You can make full screen, sir.
Yeah, just a minute. I believe it now it's full, right?
Yes, sir.
Just a minute. Okay, so as you all know, today I'm going to present on the topic of shaping the workforce of tomorrow HR strategies for AI and 3D printing in healthcare. So in this session, we will going to cover most of the part related to the human beings, because when we are studying in the colleges, the curriculum is different. When we are going on the floor, the practical exposure is quite different, and the academic knowledge is quite different. When we are doing things on practical basis, it's quite different for us. So today I will try to align with the practical things, what going in the industry, what is the updation in the industries. So I'm going to try to connect with that. Okay. Okay, so firstly, introduction part. It's I believe you have already taken 2 days session. In that session, so many experts have explained about the 3D printing and AI. So again, I'll just quickly cover it. Healthcare is a changing very fast because of the new technologies. Artificial intelligence is helping doctors in diagnosis, treatment planning, and hospital management. 3D printing is helping in making medical devices, implants, and prosthetics. This change are creating now jobs and also changing the old jobs. So I would like to take you in a different pathway, that so many people have a fear. In my current organization also, some people used to talk, AI aa jayega to kya hoga? Like, if AI will come, our jobs will be in a very situational manner. Agar AI aa jayega to hamari job chali jayegi. But I want to give you update that it's not like that. AI will create a jobs, but yes, the domain of the jobs will definitely change. It not be a same, because in 3D, in AI, when it will be invented in industries, completely era will change. And slowly it's increasing in industry also. It recently also in my current organization, we have invented a robotics in our warehouse area. Earlier we used to keep our warehouse pallets through the manual processes, but nowadays we invented the robotics. So all work is done by robotics, but yes, that manpower is still using, because operators we need to take care, we need maintenance of that machine. So manpower is always required over there. It not replace, but yes, it creates a new jobs for you. Okay, so changing the old jobs, yes. So today's era in industries, those who are not updated that much as per the technology, yeah. So in that era, they are using old machineries, they are using old technologies. But yes, but when we will go for a advanced technology, we can save our timing, we can go for a improvement of the productivity in the industry, change management. So this kind of gonna be happen in a future if technology will be increased in industries. So that myth should be not in your mind, that AI will replace, sorry, AI will remove you from the jobs. It's a tool, it's an advanced tool, and which we are using in industries to enhance the productivity. Yes, but it will create a jobs, but in a different manner. So let's move ahead. Yeah. So if you will see in bottom, why this topic for FDP? Why this topic is important for FDP? So faculty members prepare students for the future careers. If you go in institutes, like I've also studied from institute. Today I'm working in a good pharmaceutical company just because of my teachers, just because of the efforts of my teachers. So behind of the every success people, there is efforts of their parents, their teachers, and their subordinators. So if faculty will be updated, then definitely students will get a good manner. They will get a good matter also. They'll get a good updates about the industry. If faculty will be aware about how's going industries, what is the updation in industries, how industry works, what is the upcoming projects in industries, what is the demand of industry, so that that would be the easy part for the faculties to deliver the material as per the requirement of the industry, and that would be easier for industries also. Because right now I'm doing lots of recruitments, and I've seen most of the students, they are lacking in compliance, they are lacking in some tools, that skills they don't have. The reason is that there is a gap between industry and colleges. So HR is the bridge between that. So HR is the bridge who update about the updatation in industries to the faculties, that this kind of updatation is going to happen in our upcoming industries or like that, so that faculty would be able to deliver that as per the requirement of the companies or the industries. Okay. And AI and 3D printing in healthcare, they are guide student in the right way. This FDP will help faculty too. अब faculty के लिए कैसे ये helpful रहेगा? Let me explain you. Learn how workforce is changing. So initially what we were doing in industry, initially if there is an operator in industry, he's using compression machine. So if he is using compression machine, it means he will operate only compression machine. There is no another work for them. But now it's not like that. Industry required a multi-talented person, multi-skilled person who can operate granulation, compression, coating. So we required a person who would be a multi-skilled person. So that kind of requirement industry have. So if faculty would be updated about the updatation in industries, then definitely they will update to the students for the future upgrades and enhancement of the students. The second one point is understand what skills are needed. So what skills are needed, where they will get to know. This is the big question. Faculties को कहाँ से पता पड़ेगा कि what is the updation required by industry? When the trainers, when the experts of industry, when the delimonises of the industries, they will communicate to the colleges, they will communicate with the academics, then they will update what's going in the industry, what is the demand of the industry. On the basis of that, they will design, they have to change their curriculum, they have to update their curriculum so that they can deliver a good matter for the students. And the last topic is connect education with industry needs. Again, the same thing which I have mentioned earlier, that industry academics needs to update their self, their faculties, their students as per the demand of the industry. Because honestly, to be honest, I just wanted to give you one insight about the industry, that industries updating in a daily basis. Today we have implemented one of the software. Initially we used to do induction manual basis, but industry is going on a paperless working. So last to last week we have invented LMS, that is learning management software, that is the complete induction is going to happen through the LMS. So that is the updation due to the AI. So AI plays a very important role into updatation the technologies in HR, not in the HR industry, but yes, If HR will update you about the industry insights, definitely the faculties can deliver a good content to the students, and they would be a future ready for the industries, and industries have to put less efforts to build the good professional in the pharmaceutical or the healthcare industry. That is a requirement of every HR in the industry of healthcare. Okay, so let's move ahead. Role of HR in healthcare transformation. So let me explain you. अभी आप लोगों के सभी के मन में आ रहेगा कि what is the role of HR in healthcare transformation? What role plays by HR in healthcare transformation? So let me elaborate about it. HR is not only about hiring and salaries and providing bus facility, canteen facility, or something like that. HR is a bigger role. They just play a role to build a good professional, because HR is the person who involved from the starting to end of the employee. When we hire the employee, when till the retirement of the employee, HR is the person who take care everything about the employee. So the whoever planning to join pharmaceutical industry, healthcare industry in future, so they need to again communicate with the HR team. Or we are also implementing new things in HR department. We are using new AI strategies in that. So day by day we are upgrading our strategies, our curriculums, and our whatever SOPs we have, whatever compliance certificates we have, that we are going to update it on the daily basis and the requirement of the companies. So yeah, so I was telling that HR not is all about salary, preparing a salary only, canteen facility, transportation facility, hiring, and not like this. Yes, HR is the person who identifies new job roles. Like so many people have talked to you about 3D is very beneficial, AI is very beneficial, but who is the person who going to recruit that peoples? So HR is the person who evaluate your knowledge, who evaluate your expertise, who evaluate your skills, so that you are scallop on which level, that you are on the mid, you're on the bottom, you're on the top. It depends completely on the skills and the expertise of the candidate. Yeah. So analyzing workforce trends. So trends means I wanted to give you update. When I was studying in college, that time there was a boom of engineering. The people used to do engineering, because there was a lots of scope in engineering. So everybody used to do engineering. But when I slowly move into, after 3 or 4 years, there is a trend of MBA. The MBA, the people wants to do MBA. So everybody is doing MBA. But yes, 3D printing and AI, that is the platform. That's not a kind of boom. That would be a long lasting part, because those who are getting skills related to the 3D printing, they have expertise related to the AI, they have a expertise related to the Gemini, Power BI, whatever updated version AI have. I'm including all the beneficial tools that is using by search engine optimization. So that all it not on a boom, it would be a long lasting, because it's increasing our productivity completely. It's playing a very good role in industries, increasing our classification of the justification to the machinery, the case studies, and the machine telling, and the efforts of the company. So it plays a very important role, I mean to say. The second point is collaborating with leaderships. Yes, HR works with clinical and administrative leaders to align new roles with the evolving healthcare models. Suppose 3D printing are doing, so who going to operate that machine? So there would be a 3D printing operators, there would be a diagnosis operators. So that kind of roles that is expanding by the that is the need of industries in hospitals, in healthcare, in pharmaceutical. So it depends on the requirement. What is the requirement is industry have. So That is a part of it. So let's HR provides training to the existing employees. Yes. If let's take an example, HR provides training to the existing employees. So what kind of training HR imparted to the employees or candidates? So HR includes so many trainings. So first one is the TNI, that is training need identification. Firstly, we will evaluate the candidate, that what kind of candidate, in which kind of domain candidate are. If they are related to the production, so we need to find out the TNI, that is what is the need identification of that specific employee, specific candidate. On the basis of that, we need to plan a training for them. So that is a part of training, upskilling and reskilling. Like upskilling, reskilling means like, suppose I am doing a recruitment. Anuj is doing recruitment in existing company. Anuj is completely frustrated with recruitment. Now I don't want to do any kind of recruitment. So upskilling is like, now I wanted to take care the compliance part of the company. So compliance part is like labor management, your compliance management, and your industrial code, labor code, and union coordination, PMS, performance management system. So that is a one kind of upskilling. So HR is defined the trainings for the employees, for the candidates, those who want to work with their interest, wherever they want to interest. If they want to change their domain, HR help them out to identify their areas as per the requirement of the industries. So the last topic is promoting continuous learning. Yes. So you every time heard from your teachers, or we also know that हमें भी हमारी teachers बोला करती थी, and we used to tell all the students that learning should be learning should be every time, and there should not be any barriers, there should not be any obstacles between learning, because if learning would be there, we will keep growing, we'll keep learning, and we will keep touching on heights. So the learning is very important. So HR always focus on that. During the employment and during working, learning should not be stopped. It should be a consistent process for the employees and the candidates. So it depends what kind of training is required by the employee. It can be related to the 3D printing, it can be related to the AI strategies, and depends on the requirement and depends on the TNI, that is training need identification. So let's move ahead. That is a glimpse of it. New job roles due to AI and 3D printing. As I told you that you do not have fear that AI is like replacing your job, or like your job in a very heavy manner. It's not like that. So AI and 3D printing are creating completely a new types of job in healthcare. It's replacing the old jobs and creating a new jobs. So AI data analyst for hospitals. So like AI is creating a so many softwares, they are creating a so many strategies in industry. So we required AI data analyst for hospitals, healthcare robotics assistant. Robotics we have invented. So yes, there would be a, when we were using two or three manpower there, but yes, that time we need to use only one manpower. But yes, but there would be another scope of increasing a manpower in the maintenance of the machine, the maintenance of the robotics, the cleaning of the robotics, time to time manage of the robotics. So that kind of job will be increased. Healthcare robotics assistant we required in hospitals, 3D printing technician for prosthetics we required, biomedical engineer with the printing knowledge. So HR must recruit such people and also trained current employees. So it's not like that मेरे यहाँ आज कोई compression machine चलाता है तो he would be continuously operating a compression machine. And just upskill, will provide the upskilling training, so that he will also learn the 3D printing expertise. He will learn the analyst, AI data analyst expertise, so that we can move them from another from one domain to another domain. So that's completely depends on the requirement of the employee, requirement of the need, and the need of the business. So it's completely depend on it. Let's move ahead. Skill gap in current workforce. So skill gap. Skill gap is most employees in healthcare have traditional skills that I have mentioned. So many people they have a fear that मैं ये machine चलाऊंगा तो खराब तो नहीं हो जाएगी. So they have a fear. Most employees in healthcare they have a traditional skills. So technologies day by day technologies is increasing. AI is inventing new technologies, but some old mind of peoples they think नहीं नहीं ये तो ऐसा होता है तो ऐसा ही होगा. It's not like that, because they have a mindset, the old kind of mindset. In our present organization some people have a mindsets. Whenever we talk about the change, people start scolding, people start shouting. Everywhere would be, it would be everywhere. So don't be panic about it. Whenever would be the change, there would be a panic inside the current workforce or wherever we are doing the change. They are good doctors, they are good doctors, but they don't have a good expertise related to the 3D printing and the AI strategies. Nurses or pharmacists, but they are not fully ready for AI and 3D printing. So once AI and 3D printing completely will be imparted in the country, that time there would be a problematic for the existing people. So we need to upgrade our skills as per the requirement. So day by day our technology is increasing, so we start learning that how it works, AI, how AI working. So that kind of things we need to learn. If need some help, take help from your seniors, take help from your colleagues. So it definitely help out to everybody. So that would be a very helpful for us. Lack of digital awareness. So people don't have much idea about awareness about the digitalization, because initially we used to make a line in banks, we used to pay money through like a barter system or like this. So now we are digitalized, we are using mobile application, we are not going banks for the money transfer, or we are not going money, taking a checks or like that. So that is a change just because of the digitalization, just because of the advancement of the technology. So that is the less knowledge of data handling. The second point, the less knowledge of data handling. Whenever AI is working, the proper command, the proper data feed, and the proper data synchronization is very important in AI. Who will going to do that? For the same also, there would be a AI technician required over here. So if people will be uh, ready for that, if people will be trained for the AI, they would be easy to do that. So that is the requirement. So the third point is fear of using new machines that I have mentioned. They have a fear. मैं ये चलाऊंगा तो खराब हो जाएगा, ये हो जाएगा, कैसे चलता होगा. So don't be afraid about it. That is the technology that make our work easier. So we need to learn that, then we need to use it as per the requirement and as per the flow of the machinery and the part of it. As HR must fill these gaps through training and development. So completely I'm agree with it. That gap can be filled by the when the academic and the industry will be connect with each other. Definitely it will fulfill the gap of between industry and the academics. So let's move ahead. It's not much about it, it's just a picture. So please have a look on that. Roles in 3D printing: modeler, printing operator, quality control inspector, engineers. So it's just an overview about it. Yes. So recruitment strategies by HR. So initially, let's take an example of my work culture. Actually, initially, not much back, yeah, but 1 year or 1.5 years back, we used to do the recruitment by walk-in drives. We used to do recruitment by sourcing a CVs or something like that. But today, completely changed. Recruitment is the first step of build the future workforce. So hire people with the both technologies and healthcare knowledge. That is the advantage of the industry, both technology and healthcare knowledge. Suppose you have an idea about AI strategies, you have an idea about how 3D printing, what is the upgradation in the industry. So if you have a knowledge about it, if you have a healthcare knowledge, if student have that knowledge now, industry will prefer them. So being a faculty, I'll just request to all that that updation, that advantage of the industry, that should you have, so that you can deliver to the students as per the requirement of the industry. So always industry always prefer the candidates who are good in data management, those who are good in data analytics, those who are good in people management, those who are in like people centric, and the people are good enough in their technical knowledge. So industry prefer that candidates, and if candidate is good in that, I'm pretty damn sure if I would be on that place, I will definitely hire that candidate for the specific role or for the whatever requirement we have. So partner with colleges and universities. Yes, if industry will do the partnership with the colleges, if or colleges will start connecting with the industries, they will be update. They'll get the updation about the industry, what's going on in the industry, what is the updation happening, and what kind of the flow industry is following and the companies. So that is the major part of it. So the third point is use AI based hiring tools for faster selection. Yes, I am using that, because as I mentioned, I earlier used to source the candidates from Naukri portal, Indeed, used to do a walk-in interviews. Now the era has changed. When you will go on Naukri now, you will see one option: put your 10 to 15 seconds of video. So you have to prepare your short introduction video by yourself, and then you have to upload it by yourself. HR will analyze, or HR will evaluate that video. On the basis of that, if he would be okay with it, then he will call you for the interview. He will call you for the upcoming whatever requirement they have, if you fits on that parameters or the criteria of the company. So that would be the part of it. So it's again completely we are also enhancing our technologies in HR department. Initially, we used to do recruitment by manual basis, but now we are using AI tools for the recruitment. Now, the one of the most tool we have, that is ATS, that is applicant tracking system. That is the tool that is implemented by EY company. So EY company implemented ATS with the help of AI, and in that Naukri, Indeed, your career builder, all this Naukri portals are integrated with software. Whenever we will, suppose I have a vacancy for HR recruiter, I'll put boolean HR recruiter. That AI platform will fetch all the CVs from this all the platform, because all the platforms synchronize with the single platform. So that is the big change in recruitment in HR. So that is very helpful. To be honest, it saved my almost half day, because it's very time saving. It's very time saving, to be honest. So it's not like that we are also using AI in our departments. So definitely it's going to be a very popular when it will be coming in every parameters, that you will get to know about what is the effectiveness and what is the benefits of the AI. But yes, again, it's not removing the jobs. Again, I would like to highlight that point again. So build employer branding as a tech friendly healthcare company. So build employer branding. It's all about the whenever it's like we are an employer, and the technical part is very much strong, that time the candidate will easily get the chance to place their job in a very safe manner. They'll never have to find the jobs. The jobs will walk away and just to the candidates who have a expertise related to the tech friendly and the healthcare technical knowledge about the processes of the industry with the AI tools and with the 3D printing areas. So that is the strategy about it. So let's move ahead. Yes, training and development. I want to highlight the training and development. Training is the most powerful HR tool for change HR must. So everybody knows training is a very important. We are conducting this session also for the training. I'm just giving you something. I'm just explaining you something. You are getting something. So that is also a one kind of training. So training is a very important part, and let's going with the topic. So organize short and easy course on AI and 3D printing. So I wanted to update you that for our employees also, we have identified some trainers from Indore, and they delivering training once in a 2 week, and not in AI. They majorly cover that compliance and the upgradation in pharmaceutical industry. So ultimately in upgradation, they explain about what is the upgradation related to the AIs, what is the upgradation related to the softwares, what is the changes as coming, and what is the upgradation coming in machinery. So all the expertise, all the knowledge trainer have, they deliver to the our employees or the candidates. So that is the very big tool of it. And in our industry also we have created. So in colleges also, in their syllabus also, college should try, or faculty should try to give them a little idea about the AI and 3D printing, so that they will be tech familiar with the, as well as with the knowledge of technical expertise with the with and your whatever domain knowledge you have. So the second topic is use online learning platforms. So I'm just delivering you that session. Before delivering this, I explored so many platforms. I just gone through with the that so what is the best I can deliver to in my session. So that's why I explore it more, and after getting all the matters, I just compiled it, make a presentation for you, and just delivering with you. So you faculties or you can suggest to the students that they can use online learning platforms for the upgradation about the industries, about the healthcare industry, so that they will be updated for the requirement of the industries. So the third topic is give employees opportunities to practice on a real machines. So most of the colleges they have a like curriculum. They students have to do internship in their mid semesters, and they have to do, like, some colleges offers in like real based practicals. They have a real presentation expertise, HANA projects. So they have a multiple curriculum like this. So yes, so if industry will allow the students, definitely we always, in a year we always allow almost 100 plus students to do the internship, and we allow them to see how machinery works, see how industry works, what is the norms in industry, what is the upgradation in industry. So students will be updated, and if student will be updated, then definitely they will be industrial ready. If they would be industrial ready, so that will play a very big role in the economy of the country. So that is a very important part of it. So give employees opportunities, practice on real machines. We are giving opportunities to employees, but yes, I'm including students and the candidates also in this topic. So invite experts to share knowledge. Yes, like the Atal AICTs conducted this session. This again. So we are sharing our knowledge, that whatever we experienced in our current role, and whatever we are experienced in our like earlier whenever we have joined the industry, that we are just sharing with you, so that you will get idea that how you can enhance your knowledge as per the requirement of the industry, and how can you can deliver whatever matter you have learned, that you can deliver to the students as per the requirement. So that is all about it. So let's go next. Yes, upskilling and reskillings, we already talked about it, but like a quick review about it. Upskilling, there are two approaches. Upskilling, improving current skills, that I have mentioned earlier. Current skilling skills, I'm doing recruitment, that I'm if I'm doing recruitment, I want to move into different domain, definitely I'll go for a compliance, I'll go for a admin activities, I'll go for a different things. Definitely, if somebody is the AI technician, he want to move into new upgradation softwares, that definitely will give them a training on upskills, and they will get enhance their trainings on upskilling. The next one is reskilling, learning a completely new skills, that is a reskilling. Suppose in upskilling I was upgrading my skills, but yes, in reskilling I'm just learning a new thing completely. New thing is like, आज तो मैं एचआर में काम कर रहा हूं, बट यस मेरा मूड हुआ आई नीड टू मूव इनटू प्रोडक्शन, so I'll definitely go for a production, I'll start learning for production, I'll start learning for the whatever insights productions have, how industry works, how department works, what is the SOPs, what is the procedures they have. So that is a reskilling. So that is the major difference between upskilling and reskilling. That is the major, and that is the very important part of training and development of the employees, candidates, and students, and the faculties also. So let's move ahead. Change management. Employees often resist change. They fear losing jobs to machines. मैं शुरू से बोलते आ रहा हूँ, like so many people have a fear that if AI will come, our jobs will in a very like fear manner, हमारी job चली जाएगी. It's not like that. Communicate clearly that AI and 3D printing will create new opportunities. It's replacing your jobs, not losing your jobs. You are replacing your jobs, not losing your jobs. So for advance, you need to upgrade your skills. You need to upgrade your partnership skills. That is a very important part of it. So you need to done it up as per the requirement. Show success story from your other hospitals, those who have, like, you can just share the stories, the whoever that done their AI trainings or their 3D printing trainings, and they are just initially they were working as an old professional or a manual processor, but now he is working as an AI technician. So you can just share their stories to your students, or you can impart that part to the students, so that they will be motivated and they will be very happy to hear that stories, and they will try to become like that. And the third point is provide emotional and professional support. Yes, that is the very important part. Some people or some students have a mindset like emotional support they want. Some people, if you'll explain something to them, they don't try to understand that no, it's not like that. AI definitely, when AI will come, definitely we will losing our jobs. When we'll upgrading our strategies in AI, definitely we'll losing our jobs. So we need to give them a emotional support also. We need to give them a upgrade. We need to give them a proper support on it. So that is a very important part on it. And the professional support, I have already mentioned that technical knowledge and theoretical knowledge, whatever they're related to the domain, that is important part of it. So that is all about the change management. But there would be anywhere, wherever there would be a change, there would be a sound, there would be a so much shout on that. Okay. Employee well-being. Technology change can bring stress, confusion. Yeah, definitely. Whenever new technology will be implemented, like suppose, and as I mentioned earlier, that recently we have implemented LMS, learning management system. So people have confusions that because they have a hands-on experience of manual practice, they have a manual practice, but yes, we given a proper training, we imparted a proper training, and some people, they are not familiar with the system, and they are not familiar with the software, so they have a lots of stress कि कैसे होगा, क्या करूंगा, कैसे करना है. So they have a very much stress, so we need to give them a proper training. We need to give them a proper understanding about the softwares, that how it works, how goes it. So if we'll given in that manner, definitely will help you out to the workplace, to the students, to the faculties. So let's going with the points. Provide counseling and stress management programs. Yes, if your employees, if your students are feeling due to AI or so, we can plan counseling for the students, we can plan state management programs for the students, for the employees we are doing, and for the candidates also we are doing. Encourage work life balance. Yes, so sometimes people, students feel frustrated that AI आने की वजह से क्या हो जाएगा, हम तो हमें तो कुछ समझ में नहीं आ रहा कैसे करेंगे. So we need to explain them when AI will, suppose today I am working 8 hours in a day in my work job. So if there would be an advanced technology, I can complete my task in 4 or 5 hours. Remaining time I can use in my upgradation of skills, so that I can give time to my family. I can give, there would be no another stress, because I've seen so many people, they late stay in their offices, and they're just doing lots of work by staying 8 9 9 o'clock. So that is very hectic for them. So we can encourage them about their work life balance. If technology will increase, definitely your work life balance will be improved. You can easily manage your work life. So that is all about it. So the third topic is give appreciation and recognition to the employees who learn new skills. So it's applicable to the students also, that those students, they are learning, and they are, and it is applicable to faculties also, that if they are taking new initiatives to learning AI, 3D printing related to the upgradation of the industries. They are trying to approach to the industries for their personal expertise enhancement. So definitely we should recognize them. We should give them awards, rewards. So that would be a motivational part for the students and for the faculties also. So college can take a initiative on that. That would be a very helpful for that. So let's move ahead. Diversity is inclusion. Healthcare technology needs people from different field and backgrounds. So suppose I am today I'm working in HR in one of the best pharmaceutical company of India. I want to move into hospital, then I can easily move, because I have a expertise related to the same work experience. I'm working in HR. The work can be different, but yes, it will be a similar. So industry need a person with a different exposure, with the different expertise, and the different technology expertise with their areas of enhancement, the roles of their particular specification of it. So again, it depends. Diversity and inclusion majorly focus in industry will talk about, we majorly focus on females, that increasing the number of females in the workplace, but it's not like that. We require people from different areas, so that everybody can put their efforts, and we can make a good success industry, and we can make a good success country in this world. Give equal opportunity to all. Some in some companies, or in some industry, I have seen that some of the management, they are not allowing female employees to handle the machines or something like that. It's not like that. The machines, it's not a rocket science. It's, yes, definitely the proper use, the proper knowledge of machine, it should be there. Yes, if they are familiar to use that, definitely we should then give opportunity to all to operate the machines to whatever requirement we have. And third topic is encourage multidisciplinary teams. This will be bring more innovations. I hope I no need to explain this point, because everything is explained in this point only. So let's move ahead. Yes, faculty role in workforce development. What is the role of faculty in workforce development? So faculty member must align with the industry. If faculty will be aligned with the industry, then they can deliver a good content to the students. So teach students basic teach students basic of AI and 3D printing in healthcare. Add small projects in curriculum. Yes, I've mentioned earlier that if a student will if a student will learn the upgradation of the industry, that would be a very easier for a student to get a job in a very short term, because the competition level is very high. So everybody have to fight a big level. So add small projects in curriculum so that students will be familiar with the AI, 3D printing tools, and whatever updated strategies, whatever updated softwares coming in AI and 3D printing. So work with HR teams of hospitals and pharma companies. So academics, again, the same point which I have mentioned, that work with HR teams. Academics should connect with the HR teams, because HR is the person who is the bridge between academics and the industries, who can connect both the parties together. So work with HR teams of hospitals and pharma companies to align both the expertise, so that industry will understand what student required, and college will also understand what is the requirement of industry, and definitely it will help out to students and the colleges as well. Guide students to become future ready. Yes, when it will be happen, when student would be familiar with everything, if he would be okay with it, if he would be upgrade their skills, definitely they'll get a good understanding about the industries, and they'll ready for the future, ready for the job ready. So that is all about the faculty role in the workforce development. So let's move ahead. HR cannot do this work alone. That is a very right point. Academia and HR must work together. अगर मैं चाहूँ, अगर इंडस्ट्री चाहे कि अगर वो अकेले ये सब कर ले, that is not possible, because academic is the place where students get the proper knowledge, proper understanding, proper division of the division of the curriculum and the theoretical part of it. So HR share industry needs, जैसा कि I am sharing you the needs of the company, that so that you will get the understanding what is the requirement of industry, so that student will be ready for the future jobs. So HR can't do that job alone. So academics and the industry have to work together so that we can make it a success journey. Faculty updates syllabus accordingly. If industry giving you some updatation that this is a requirement of the industry, so yes, faculty can update their syllabus accordingly. A student get internship and industry exposure. I have mentioned already that if a student will do the internship and they'll do the industrial visit, they'll get to know the environment of the company, culture of the company, how industry works, what is the actual work life, and what is the floor. When I'm telling you कि aeroplane चलाना है, when you will drive that aeroplane, you will see the difference कि जब बोल रहे थे क्या हो रहा था, जब हम चला रहे हैं तो क्या हो रहा है. There is a big difference between that. So there is a big difference, theoretical part and practical part. So internships and industry exposure is very important for the students. So definitely it will help you out. This creates job ready graduates. If we are following all these parameters, definitely our students will be a very strong candidate for the future ready for the country. It will contribute a big part of their life to development of the country. So that is a collaboration between HR and academic. Yes, HR technology tools. So as I mentioned that we are also using AI in our department. As an HR itself is using AI for better results. As I give an example of my daily hiring, that AI for hiring and resume screening. I'm not screening like one by one CVs. I'm not screening like that. That was a very outdated time. Now we just put some key pointers on that. that we require this kind of candidate. So AI will screen that candidates and they'll provide the CVs directly. So if you will update it about the AI, that how you have to prepare your CVs as per what kind of CVs search by AI, then only you can be able to prepare CVs as per the requirement of AI. So AI तो वही CV सर्च करेगा ना जो AI को समझ में आता है. So that अगर आपको भी एक अंडरस्टैंडिंग होगी AI कैसे CV सर्च करता है, so that you can prepare your CVs, you can make your CVs for the requirement of the AI. Okay. And the second point is digital platform for training. Yes. So digital platform, initially we were asking for the trainers to come at site and imparting the trainings or something like that. And so now due to the AI, for the advancement of the technology, we connect the trainer from the big TV and everybody taking trainings on the virtual mode. So that is a big change in it. That is upgradation. Data analysis for performance management. Before that we were using that Excel for the performance management, but now that is different. We are using data analytics for performance management, and this make HR more efficient and future ready. So ultimately, जैसा कि मैंने बताया, I'm working 8 hours in a day. Earlier I was used to do my work, complete my work, like it takes 8 to 9 hours in a day. But yes, 5 to 6 hours I can complete my task. I can focus on other parts also if I'm doing my work on the basis of the timelines of the company. So that is a very big. So that is the technologies we are using in HR also. Industry is using technologies and they are very updated about the technologies, 3D and everything they are following as per the requirements. Yes. So this is the ethics and compliance, performance management in future, employee engagement. Yes, AI and 3D printing in healthcare raise ethical questions. HR ensures employees respect patient privacy. So yes, हमने AI की बात करी. AI is there, but we need to maintain the privacy of the patient. We need to maintain the, because AI is completely based on the data. So we need to handle it very, very, very carefully manner that employees respect patient privacy. And the second one is no misuse of patient data. Ethical rules for using AI in decision making. So these are the points which are very important that comes under ethics and the compliance of AI. So we need to follow and we need to make sure there's parameters doing that. Performance management in future. HR must change performance evaluation methods. Yes, as of now, we have not adopted it, but definitely when we will go for as per the requirement of industry, definitely we're going to change it. Focus on innovation and learnings. Yes, reward and teamwork and adaptability. Use AI to track progress in fair ways. Yes, last point, we are already doing that. We are doing machine learning. We are doing time study through the AI. That एक machine का production 8 घंटे में कितना निकलना चाहिए. So we are using AI tools to study the machine learning, that is called machine learning for the time studies. So we are using AI in that machine time studies. The topic is employee engagements. Engaged employees accept change faster. HR can organizing workshops and hackathons and celebrate new achievements, give recognition to innovative ideas. So we need to engage our students, we need to engage our employees so that they do not feel frustrated, stressful, or like this. So we need to engage them time to time manner. So yes, key takeaways for FDP. So that is for you. Healthcare workforce is changing because of AI and 3D printing. So we should ready for that and we should upgrade our skills for the same. And we are going to do that, I'm pretty sure. HR is central in shaping workforce for future. I've already mentioned that HR is a bridge between academic and the industry, that who collaborate between them and who combine both the to understand their requirements to each other. Third is faculty plus HR partnership is needed to prepare students, and that is very important part. If they would be collaborative together, then student would be industry ready. That is completely a big part of it. Training, reskilling, and well-being are the key to success. That I've already explained that in training and development, the reskilling of the employees, reskilling of the students, if they are interested in QC, QA, if they want to move into production, we need to do their reskilling. And well-being are the key success. They are feeling not motivated. We need to plan their motivated sessions. We need to plan for them uh, like what we should say that stressful management sessions or like this. So that would be the part of it. That's all about it. Let's conclusion of it. AI and 3D printing will not replace humans, but they will change how we work. So that is the summarization of all the presentation. That again, I'm just again and again highlighting this point. AI and 3D printing will not replace humans, but they will change how we work. HR is the bridge between technology and the people. Faculty members play a big role in preparing the future workforce. So faculties plays a very important role because the student they connected with faculties on a regular basis. If they have a doubts, if they have any confusions, they always raise to their faculties for the resolution, so that if they would be updated, if they would be clear cut mindset, so they can give them they can deliver a proper content to the students, so that they will be a industrial ready. Together HR and academia can shape the workforce for tomorrow in healthcare. Yes, so if HR and industry and academic work together, definitely we will fill the gap between academic and industries, and we will make a good future of the students, and that would be a amazing part of it. So that's all about me. Thank you so much. Over to you, team.
Thank you, sir, for this highly informative and engaging session.
You're welcome, Anamika.
Sir, we are having some questions to please answer them.
Just a
First
minute.
is, which new jobs AI is giving to pharma professions?
Sorry, can you repeat, please?
Which new jobs AI is giving to pharma professions?
I have mentioned in presentation that AI technicians and that whatever the updated softwares are coming, so we required an operator for the same.
Okay. So second question is, what about the female students? You have mentioned that only
So
males are recruiting.
just a minute, let me open my chat box. I'm unable to open it. Just a minute. Yes, now it's open. Yes, so I'm just taking question one by one. Hmm. HR professionals collaborating with faculty to align academic learning with the evolving skills mindset need to workplace so that students are not just job ready. Hmm. Can you just announce the questions if anybody have, so I'll be answer.
Yes, sir.
Can you ask me the question? Can you read it out for me?
So the full question is, industries are not recruiting female much in their advertisement itself. They are writing only male candidate required. So what can be done on that? What about the female students?
It's not like that. I want to give you the example of it. We recently hired 100+ females in production and warehouse area. That industry is increasing their areas, and we are giving opportunities to females also in our expertise.
Thank you, sir.
Most welcome.
With this, we conclude this session of day 3 of our faculty development program. Both the sessions have been deeply enriching, highlighting futuristic trends in smart devices and AI-powered supply chain system. On behalf of organizing committee, I extend heartfelt gratitude to our esteemed speakers for sharing their expertise and to all participants for their keen involvement. We look forward to continuing this exciting journey in subsequent session. Thank you.